Dr. Izuchukwu Obi, and I'm a pulmonologist and intensivist, specializing in pulmonary and critical care medicine. I live in the Northern Virginia area in the United States. So in April, May, things were very crazy, very rough, in the sense that we didn't have any ICU beds in most hospitals in Northern Virginia. And because we just had so many cases being close to DC and Maryland, like it was such that the system was almost getting overwhelmed. Not enough intensivists, ICU specialists, or ICU nurses. Then at some point we're close with the ventilators, like worrying, okay, what if we run out of ventilators? So things got really close and things got stretched. And now we're opening up, that's where it gets worrisome again, because if people continue to be careless, the cases will spike and the healthcare system could get overwhelmed again like it did. We seen very young people getting so sick and not really having a whole lot to do apart from supporting them on the ventilator and other things, just trying to get them past the phase. And unfortunately, having a lot of young people die from this coronavirus pandemic. Young people in their 30s, people in their 40s, and even people in their 50s, with how sick they get, that's very young, considering the different organ systems that we seen affected by the coronavirus, that people get so sick to that point where people are having to stay in the intensive care unit for like 3-4 weeks on the ventilator. And many people, even with everything we do, all the advances we have here to support them from the critical care standpoint, still either don't recover, or many even die from that. So it's something that is scary. It is something that has changed the way things usually happen. Like in hospitals, we don't have visitors coming to the hospitals anymore. Like even when people's loved ones are sick in the hospital, nobody comes into the hospitals. Now we have to call and give updates, and Zoom and FaceTime has become very popular in hospitals now because that's the avenue hospital staff used to communicate with family members about their loved ones who are not able to come. So it's caused a lot of changes to how we practice and how we live here in the Prince William County area of Northern Virginia. At the beginning, sometime March, April, and even up to May, many people are not readily able to get those testing done. Like you needed to meet a certain criteria for tests to be made available to you. And many people at that point, from what we know now, probably had COVID, but they were never really tested. And that's why this number is just like an iceberg, like a small fraction of the actual number of coronavirus cases we actually have, considering that at the beginning, when testing wasn't as easily available as it is right now, very many people were not tested. But with regards to deaths, these were just those that were recorded. Some people might not have even made it to the hospital, and if they were not really tested, and we've seen many symptoms or many presentations COVID would have now that we didn't quite know at the beginning, like blood clots in the lungs, blood clots sometimes causing big strokes, which before we really knew this, people who had blood clots and died from that, suspicion that this might be related to COVID was really very low. So we're learning a whole lot as we go, but things are actually much more serious than many people actually understand it, which is another reason why there could be a lot of misconception out there, why it's so hard trying to get people to, you need to wear your mask, your face mask, you need to social distance, you need to avoid or limit those things that potentially could get you sick or have you transmit things to your loved ones at home. Being a respiratory virus, the typical respiratory symptoms like cough, shortness of breath, being a virus fever, and then over time we found out that there's some degree of diarrhea, loss of smell, loss of taste. So all these are more like associations that we find out is more like a pattern. So some of these symptoms you can find in 50% of people, some you can find in even much less. And of course, some people don't even have symptoms. They don't even know they have the coronavirus. So COVID, the virus on its own has caused, initially thinking, okay, it's a respiratory virus. It gets into the lungs, causes pneumonia. That was the initial thought process. And then from that, you're finding other organs getting involved, the kidneys, the liver, the brain, because it causes stroke, the blood vessels, and also the blood itself, where people are having an increased amount of being able to form blood clots. It could be in the veins that could cause called deep vein thrombosis, like DVT of the leg, which sometimes can get to the lungs and cause like pulmonary embolism, PE, that potentially is life-threatening. We're actually seeing it now in places like Florida, in places like Texas, in places like Arizona, where they opened up rather quickly. And with that, people kind of had the sense that, or felt that, oh, COVID is over, or COVID is almost gone. So opening up is one thing, but people understanding what we're up against and knowing what needs to be done to prevent this or to reduce the number of people getting sick or the number of people dying, that's another part of it. So emphasizing the need of wearing your mask, physical distancing, and avoiding, if you're sick, staying home. Obviously, you can call your doctor, get tested, but just avoiding those avenues through which this spreads further, because it spreads really fast when you avoid these things. And with that, things happening in Florida, it's kind of the result of all that. To be honest with you, we're just still in the one surge, like the first surge, in the sense that it's not gone away. It's just that what we've seen work with physical distancing, wearing masks, when the places closed down, the cases went down in places in the east, but places in the south that didn't take it as much, like Florida and even Atlanta, now their cases are a whole lot. My fear, which has always been the case, is the worst times for respiratory viruses is normally when you get to the fall, like flu season, the fall and the winter. And with that mindset, people were thinking, okay, when it comes summer, they expect like, okay, COVID cases will go down and then things will be flat. Then by the time we get to the fall and winter, we would have a second surge. But no, we're just still in the first surge that potentially could get worse when we get to the flu seasons, because then people tend to stay more indoors, which is also another thing that happened like in the fall and winter. And with the flu, that's a typical flu season. Flu and COVID together, that's just a recipe for disaster. So the fall, still very concerned about what might happen in the fall and the winter, but a whole lot of it is going to be dependent on how people act between now and then, if we're able to get things under control, like we're able to do in the eastern part of the United States. there's been cases of children that have been gravely ill, and there's also been cases of children who died from COVID. I think recently, about a week or so in Florida, there was somebody who was really very young, I think less than 5 or so, that died from COVID. With school reopening, it gets concerning. Though what we're doing is weighing risk and benefits, so far what's been good is that children don't get as affected like adults, like not very many cases in children so far, or they don't get as sick as adults do. But the children live with parents, grandparents who potentially might not be so lucky. So it's something that's still very concerning, that at this point in time, just based on the number of cases, I think Virginia State Governor talked about, if we're not able to stay in phase 3, then possibly school might not reopen when we get to that point in time. Children might have to do like remote online learning like we did initially. So we'll see how it plays out, but it's rather concerning. So fortunately for me, the hospital where I work, we've had good supplies of PPEs, in the sense that everything we needed to take care of patients safely were provided, be it the N95 mask or the proper, the purified air mask we wear, be it the gowns, be it the gloves. We've actually had good supply of those. It was at the beginning when it was crazy in New York, New Jersey, and supplies were really very low. Then at some point, some places were rationing, okay, you can't use more than 1 or 2 masks in a day, except if it's physically sold or things along those lines. Development of vaccination, like a vaccine, yeah, because honestly, down the road with viruses like this, what really has been shown to help over time is a vaccine. Like, if you're able to have people vaccinated, that way they're able to not get these infections, or able to fight it off better, and you're not having all these people dying. Because a whole lot of what we're doing in medicine to support them when they have this multi-organ failure and things along those lines, we are seeing some developments, like positive changes, medicines like dexamethasone, which they talked about recently from the studies they did in the UK. It's like a steroid that's been shown to reduce mortality when people are sick enough to be on the ventilator, and also on the remdesivir, which could potentially shorten the duration of the illness. But what we've noticed is that this illness takes a very long time, even for those people that survive. Sometimes people are sick for like 3 weeks. And for many that are not so lucky, especially when they get that sick, they end up in the hospitals, and some potentially lose their life to it. So a vaccination would really be what's going to save us at this point. Honestly, it's just been busy, draining physically, draining emotionally, watching people so sick and a lot dying, and family members not being able to come to be at their bedside, and people just so sick from something we're beginning to understand as we go along, because it's just not a whole lot we know about them, especially at the beginning. But now we're having more medications to potentially use to treat people with COVID. And we're learning more about things like the need to put them on blood thinners, like high doses of blood thinners for the blood clots as we go along.